Hi, this is Don's Backroom Forum. Today we're speaking with Nancy Moreau from PIC Excellence. She is an internationally renowned expert in the area of vascular research. Nancy is owner and CEO of PIC Excellence. Her and her team have created many online programs in the area of ultrasound vascular access and PIC access. She and her team create online programs and has the only certification process, I believe, in the area of ultrasound vascular access for PIC. Is that correct, Nancy?
That is correct.
Nancy works with several companies, including our own, and shares her knowledge and research with us and other clinicians around the world. So Nancy, can you tell me a little bit about PIC Excellence and the programs that you offer?
Absolutely, Don, and thank you for asking. PIC Excellence is an educational company. I've been committed to education since my original passion with PIC lines and with vascular access. PIC Excellence has become an online educational company in that we have more than 30 programs. We do workshops, we provide resource information, and we also have a process where clinicians can validate their knowledge, their competence, their overall excellence with PICS and ultrasound through our CPUI, our Certified PIC Ultrasound Insertion Certification Program. And so PIC Excellence provides resource for clinicians and really for patients also to learn more about best practices in vascular access.
So not just PICs, also peripheral IV starts?
Absolutely. We include all types of intravenous devices in our educational programs and provide a wide variety of information.
So how do you see the future of PIC Excellence, and where do you think you're headed with it?
Well, in this, our 25th year, PIC Excellence is changing up our programs. We are moving to a shorter format and to a layered, tiered approach that creates a pathway for learning, takes clinicians through the fundamental levels of peripheral access, and moves into the more advanced levels of ultrasound, ultrasound-guided peripheral access, midlines, PIC lines, central venous catheters, neonatal, and pediatric. And so we're in the process of redoing our entire format and leading folks to a higher level of understanding with these vascular access devices and creating more possibilities for certification. These should all be available soon.
See, I remember my first experience with ultrasound in the back room, hence Don's Backroom Forum. Tell me about yours.
Well, I remember when I first started as a graduate nurse thinking that as I inserted intravenous devices on pediatric patients, I dreamed of having the ability to see inside their arms, to really know where the veins were located. And so when ultrasound became available in a portable form, in a more reasonably priced and available format, I jumped on it, included it in my educational programs, and found a way to incorporate it into all that we did with PIC Excellence. At PIC Excellence, we feel that ultrasound is a safety requirement, that by using ultrasound that we increase the bar on safety and provide better assessment, better needle guidance, and higher levels of success. And so it has been our commitment to incorporate ultrasound into our education and in our certification programs.
I know the first time I used ultrasound, when I first saw an ultrasound machine, it was in a back room. That's why we call it the Backroom Forum. The machine was the size of a refrigerator, and I never imagined that we could hold something in our hand and take it to the patient. Just amazing. Plus there was no such thing as real time at the time, where you could actually see live imaging as it was happening inside the patient. I know you're pretty big into ultrasound. Do you use it on every IV start?
No, Don, I can't say that I do. Ultrasound is very exciting and I love using it. But I would say right now I use it for peripheral access maybe about 50 or 60% of the time. There are those patients when the veins are so obvious that there's no need for ultrasound. But I have to say, difficult intravenous access patients, obese patients, patients with challenging vasculature are becoming more and more common. In the literature it says more than 50%. And so we find that when you go to see a patient, being able to have ultrasound to do an assessment of the veins, to choose the best location, the best size, to understand the depth, all of those components add in to helping you to be more successful on the first insertion. And so while I may not use ultrasound every time, ultrasound is definitely in my toolkit and available to me for whatever patients I come across.
So can you tell us how much ultrasound has benefited you personally and the patients that you use it on?
Absolutely. I think that ultrasound has made a huge impact on vascular access practice, taking it from success levels that sometimes were as low as 50, 60, 70%, up to levels that are higher than 80 and 90%. At this point in time, we know that as clinicians that if we're using ultrasound and have been trained well, that we're going to be successful on the first attempt almost every time. Well, what this does for patients is it gives them more confidence, gives them less anxiety, helps them to know that there are possibilities for gaining access that don't require numerous attempts. We hear all kinds of stories from patients where they've been stuck over and over and over again. We know from the research that multiple attempts may even lead to higher levels of infection and other complications.
Wow.
And so being able to employ ultrasound is a benefit to the patient, not only in reduced anxiety, reduced trauma, but also in reducing complications and giving them confidence to trust us in the healthcare system to help them and to get better.
I know a few years ago I was in the hospital and I did have an IV, and the person inserting the IV did miss the first time around. Eventually we got in the vein, and that IV failed after 2 days, and I had to have another one inserted. So do you think ultrasound would have been a benefit in that case?
Well, ultrasound is definitely making it possible for us to put a catheter in the best place, to put the right catheter in as far as length and amount of catheter, and to have it last longer. What we've seen from the research is that scheduled insertion that we used to do every 72 to 96 hours is no longer necessary, that there's no added benefit, that we can leave peripheral catheters in as long as clinically indicated, as long as there are no complications. And so being able to use ultrasound to place it well the first time can equate to longer dwell times and better outcomes.
You and I have had conversations about a new program called the PIV 5 rights. Can you talk about that just a little bit?
Yes, so I've been involved with research that is applying peripheral 5 rights bundle. PIV 5 rights is what we're calling it. And that bundle of practices has been shown to increase first-time success, reduce the number of attempts and the supplies that are used on every patient, as well as having a significantly longer dwell time with these catheters. Our end result for the research was to show that patients could actually have one catheter for the whole length of therapy. And up until this point with the research, we've not been able to prove that that was even possible. It was more like a dream. And so now we have some proof to show that by using these 5 rights, this bundle of practices, that we can achieve the levels that we only dreamed of.
I know I was in the hospital a couple years ago, and they did do an IV. They missed the first time. The second IV lasted 2 days, and then they had to redo it again. So that would benefit me, I guess.
Oh, absolutely. And really prior to some of the research that we have on changing peripheral catheters only when clinically indicated, we've been rotating peripheral sites every 72 to 96 hours. And now we recognize from the research, from randomized controlled trials, that there's no benefit in that. So being able to put it in right the first time in a method like the PIV5 rights is making for longer dwell times when we don't have to have scheduled replacement.
What are the steps involving the 5 rights?
So the PIV5 rights, the first right is to have a proficient inserter, someone who's qualified and trained. The second right,
And you can help with that, correct?
and Pick Excellence does provide training. So number 2 is to be able to have ultrasound and a method to perform the insertion in a way that's most effective. Number 3 is to select the right vein and the right catheter based on the depth and the length that's necessary. Number 4 is to utilize the right supplies and technology. We found that by using anti-reflux needleless connectors, by using antimicrobial dressings, that we have better outcomes, and it's part of the bundle. And then number 5, which is actually most important, is to have a daily assessment by someone who's qualified, can understand everything with the assessment of the site, to be able to determine if the dressing needs to be changed, if there's a problem developing, if everything is functioning correctly, and to perform pulsatile flushing. So making sure that everything is good and implementing care and maintenance. All 5 of those things work together to make sure that we have success on the first stick and longer dwell times. And the 85% success that we had with the first pilot study shows that they actually work well.
So it seems to me like number 3 is where ultrasound fits in?
Well, ultrasound fits in for insertion, but also for assessment of the vein, determination of vein size, so you select the right catheter size, determination of depth so that you have the right length of catheter. So ultrasound really works on 2 and 3 to make sure that you have an excellent insertion and that you're using the right vein and catheter.
So how important is using peripheral ultrasound for vascular access in relation to the 5 rights program?
In order to do the PIV5 rights, you need to have the opportunity to use ultrasound. That doesn't mean that it's used every single time, but to be able to provide a good assessment and to choose the best vein for the patient, ultrasound is necessary.
So we did briefly touch on how the 5 rights can benefit patients. How can it benefit hospitals and health systems?
So we talked a little bit about hospitals, but if you look very closely at the consumption of IV catheters, of peripheral catheters in each hospital, on average, hospitals are consuming between 7 and 9 catheters per patient visit. You multiply that out over a year's time, the total number of admissions, it's a huge number.
Wow.
By applying the PIV5 rights, you can reduce that consumption down to 1 catheter. 1 catheter for the full length of the patient's admission, for the patient's stay. The hospital has the potential to save millions of dollars. And we've already seen that within this first trial.
So I think you told me there was a study that would back that claim up.
Yes, so the study was done at Hartford Hospital with Lee Steer and his group. That manuscript has been submitted and should be published soon. But they also have some preliminary published results that came out a couple of years earlier in the Journal of the Association of Vascular Access, JAVA. So you should see both the results of the PIV5 rights and the preliminary research that were done. Lee Steer, S-T-E-E-R-E, as the primary author.
So Nancy, you've had some experience with the EchNous vein. Can you talk about that just a little bit?
Well, Don, for me, the EchNous vein actually provides an excellent ultrasound for peripheral vein or arterial access. What was most important for me was the high resolution, the clarity of images, and the ability to do needle guidance easily and fast. For a vascular access specialist, those are the most important things that contribute to success. Having a good ultrasound with a clear image quality is most important, and also supports the PIV5 rights program with the EchNous vein.
Nancy, are there other companies involved in supporting the PIV5 rights?
The PIV5 rights program is actually being supported by multiple companies. My time and initiative, a part of that is being covered by Nexus Medical, as well as Introtech and B. Braun, and then, as you said, with EchNous. So there are about 4 different companies, in addition to Pick Excellence, that's supporting this initiative and trying to provide the information to clinicians to be able to implement this program, this performance improvement program within their hospital.
And where can a viewer of this video or somebody interested in the PIV5 rights get more information about it?
Yeah, so there is a website that's available, pivfiveright.com. You can also email me, nancy@pickexcellence.com. That's piccexcellence.com. And so that way you can get more information, and I'm happy to send them the protocol, talk with them about the process. We include a PDSA process where it's a Plan, Do, Study, Act Performance Improvement Initiative. And so plenty of details are available, and even a presence to help with the research. We're all rather committed to applying this PIV5 rights to increase patient safety.